Hi guys, my name is Sissy and I'm a psychiatrist, and I'm going to explain what PTSD really means. PTSD stands for post-traumatic stress disorder, and it's something that is used a lot in like regular conversation. But like, oh, that person gives me PTSD. Oh, I went to this restaurant, the person was rude and I gave me PTSD. So PTSD is actually a real serious mental illness. I had symptoms of PTSD before, and I've made another video explaining all like my entire story. If you want to go check that, I will link that in the description below. So I'm going to read this from the ICD-11, and the ICD is the International Classification of Disease. So it's what we use when we are making a diagnosis for someone as mental health care professionals, and you have to like follow this particular criteria to someone has PTSD. I'm going to just read. So PTSD, according to the International Classification of Disease, says that it's a condition that arises due to a delayed or protracted response to a stressful event or situation of an exceptionally threatening or catastrophic nature, which is likely to cause pervasive distress in almost anyone. So that thing that's causing you PTSD has to be a trauma that is so severe it could be distressing to almost anyone. That's why you can't just say someone was rude to you and give you PTSD. Typical features include repeated reliving of the trauma in forms of memories, or reliving the memories or even the thoughts. Flashbacks, this is where you feel like it's happening all over again. Nightmares or dreams, so dreams or nightmares about what was happening. It could be happening again in your dream. All this occurs on a background of emotional numbness. Yeah, emotional numbness, emotional blunting, and detachment from other people. So I did have emotional numbing actually for me, which is where I'm just there, not feeling. Detachment from other people, I did start to feel like I was detached from other people. Unresponsiveness to surroundings, so you can feel like you're not responsive to things, you're just there but you're not really there, or you're like dissociating. I actually did have that, a bit of that. Anhedonia, which means that you lack interest. You stop enjoying things that you used to enjoy before. So for instance, you're a good cook and now you no longer enjoy cooking. Also, for instance, you liked playing games, now you no longer like playing games. So that's anhedonia. Avoidance of activities and situations reminiscent of the trauma. This is a big deal. Maybe you had a car accident in some place and now you avoid that road all the time, or you avoid anything that reminds you of that thing all the time. So avoidance is a big sign of unprocessed trauma. If you are avoiding things all the time, specific things, then it means you've probably not processed the trauma around those events. There's usually a state of autonomic hyperarousal, so that means with hypervigilance, enhanced statutory reaction, and insomnia. So hypervigilance means being on alert, constantly on alert. Like you see maybe the coat is hung up, you think it's a person. That's how I was. Like I was constantly seeing things in like shadows and darkness. I was just constantly living in fear. And an enhanced statutory reaction, again, like I mentioned in my other video, like my 3-year-old would just start on me. And insomnia, which is difficulty sleeping. So I didn't have insomnia because I was still sleeping. Also, I had a 5-month-old who was always awake. Like I couldn't, I wasn't sleeping. So whenever I would get a chance to sleep, I would sleep. Although for you, if even when the baby sleeps, you can't sleep, then that might be a sign that your mental health is not doing well. If you've watched this video up to this point and you're liking it, please give it a thumbs up. That really supports my channel. It also helps the video to reach to other people who might actually be needing to know this information. Thank you. Anxiety and depression are commonly associated, but not necessarily that you always have depression as well. But anxiety, PTSD in its own sense is an anxiety disorder, so it means that it's anxiety thing, like hyper alert. So at this point, I want to talk about CPTSD briefly, which I think I'll make another video about. But CPTSD is complex PTSD, which involves everything we've talked about, but also has emotional dysregulation. You will be not able to regulate your emotions, high irritability, like mood swings, dissociation, more of the dissociation, and emotional numbing, which also is there in PTSD. So they're really, really similar, but the main added thing is emotional dysregulation, which is why in the other video when I was talking about my story, I said at some point I was like, do I have CPTSD? Do I have PTSD? But in the end, actually, I think I had none of them, because altogether I didn't have all the required symptoms to fit only one. And I think most people would be like that. You'll have like one thing here, one thing there, and where it doesn't equal to so for instance, to have depression, you have to have a certain number of symptoms, but it might not equal to the ones that we say you have depression, but for you, you feel like you're sad and your life, is not worth living or whatever. So I think you don't need a diagnosis. If you feel like you need help, please go and seek help. After all, it's not even your decision. You shouldn't be the one trying to think, oh, have I got this, have I got this, even though you're a doctor. Especially if you're a doctor, you're more likely to misdiagnose yourself. So please do be seeking help. Do reach out to practitioner health if you are a doctor in the UK, because they do provide free mental health support for doctors. So in terms of the causes of things that can cause PTSD, it's not just anything. And these are the examples of things that can happen. Number one, physical and sexual assault. Being assaulted, obviously, is very traumatic, physical or sexual, especially in childhood, which was my case. Childhood abuse or domestic abuse, even witnessing abuse, by the way. So it can be witnessing or experiencing something severely traumatic. So imagine you're a child experiencing domestic violence. That can be really traumatic. Or even if you're not a child but you're an adult and you're experiencing some other horrors, that can be traumatic. War and conflict, if you think of all those people going through all those wars in different parts of the world, in the DRC, in Sudan, in Gaza, like imagine all the trauma they're going through. And also torture, obviously, torture. And those are some of the examples, but they're not the only ones that you must have in order to have PTSD. The good news is that PTSD is a treatable condition. You can treat it and not have the symptoms anymore. You really can. Even me, my fear that I had, I don't have them anymore. I no longer have that startle response, for instance. Like I am much more calmer and happier, and yeah, I'm loving my life now. So the treatment, according to the NICE guidelines, which is the UK's, it's called the National Institute of Clinical Excellence. So that makes the guidelines that we should follow in the NHS, for instance. So they say that you need to be offering the person talking therapy, number one, and it needs to be trauma-focused talking therapy, of which you need at least 8 to 12 sessions of either CBT, so trauma-focused cognitive behavioral therapy, narrative exposure therapy, or cognitive processing therapy, or even EMDR, which stands for eye movement desensitization something. Sorry, I'll put it on the screen there. EMDR therapy are really good for PTSD, and they're all offered on the NHS, but under long waiting times and things, or even privately. You can get them privately. So you need at least 8 to 12 sessions of talking therapy. And some people, depending on the severity, might also need medication. And the medication for this is actually, there's antidepressants that help with anxiety and to reduce the anxiety, because if it's severe, you might be that you can't actually be talking, you can't be talking about things yet, and yet you're very, very in a state of emotional numbing, dissociation, you're having nightmares, you're reliving things, like your life is just going so horribly, not going well at all. Then medication can also be provided, and the NICE guidelines do have specific medication that they recommend, which are a specific antidepressant, and in some cases you might also need an antipsychotic. So it depends on what's going on really with you. You just have to be seen by a psychiatrist, ideally, but depending on where you are. Even GPs, I think, should be able to do this. Or really depends on where you are, but getting an approved mental health professional who knows what they're doing. In summary, really, PTSD is a treatable condition, and it's not something that you need to live with the rest of your life. And actually, you can move over it and process that trauma and live a better version of your life. If you want to watch my own PTSD story, then watch this video here.